and I am a graduate counseling student, and I'm just about to take the NCE soon. So what I've done is I've taken a bunch of notes, and I wanted to make those notes into PowerPoint slides to help me study for the NCE. So what I'm doing here as part of this video series is to share it with you guys, and hopefully it helps. As I said before, we're going to be talking about group therapy. What is a group? So a group is something where the membership can be defined. Then there's some degree of unity and interaction and a shared purpose. So these are kind of like the core elements of a group. So there might be a question on the NCE about this. So, a group is like, if you think about it, like random people stand together outside of a shop. They're not necessarily a group, right? A group needs to have some sort of definition. What is required to be part of this? What does membership entail? And then some degree of unity and interaction, right? And then a shared purpose. They're working towards something together. All right. And then the person who coined the term of group therapy is Jacob Moreno. So shout out to him. That's him on the left here. And he was the father of psychodrama as well, which we'll talk about. And that is basically, he was observing people who were in theater and doing these, I think, improv plays. And he realized that they were experiencing some sort of emotional release from doing these. And so through that, he realized that improv could be used as, a therapeutic tool. So psychodrama is basically that. It's using like theater and improvisation to kind of express emotional concerns and work through them. And then the other thing about group therapy is prior to World War II, therapy was mostly in this dyadic model, which means two people. So it's like the counselor and the client. But then due to a shortage of individual therapists, the movement towards group therapy started to pick up, which makes sense because one counselor could see more people. Okay, so in order to set up a group, you want to kind of consider these factors. So the ideal size for a group is 6 to 8 members. And then there's like some nuance here. So according to this, I believe I got this in the purple book. If the group is lasting more than 6 months, then apparently up to 10 people is still ideal. However, some sources that I have seen will say 8 to 10 people is ideal. So I'm not really sure which number the NCE is going to go for, but I would say if you see roughly in this range, I would say 8 is the most common number that I see. So if it's either 6 to 8 or 8 to 10, I would pick that. I don't think they're going to make it super dicey, but just keep that in mind. So that's why I have in this little heart here, 8 as our magic number. And then for kids, it's generally recommended to have smaller groups, which makes sense, right? Kids need a little bit more close attention. If you've ever seen how like a preschool classroom or kindergarten classroom is run, it can get pretty chaotic, right? And so even a group of 3 or 4 kids, any more than that, the leader might start to kind of lose the kids' attention. So there's 2 types of kind of groups in the sense that there's open and closed groups. So open groups are meaning that at any point, new members could join the group. Okay. And it's kind of like rolling admissions. Okay. And then a closed group would mean that once the group starts, no new members can join. So there's pros and cons to both of them. So for an open group, this kind of helps is if you like lose a bunch of members, then opening the group, you're able to get new members to kind of make sure you're in that range of maybe 6 to 8 or 8 to 10, whatever. Like for example, for my internship, right, when we were really trying to get group hours, it's probably best to have an open group, right? Because if people don't show up or people start dropping out, you want to have more people joining, okay? And it's kind of a way for organizations to make money too. On the other hand, closed groups, um, the benefit is that members build that relationship within the group. And so they get to know each other. And so, they don't have to worry about like, who's this new person who's going to be learning all my information now, right? So you get to kind of move along the process with the same people. And then there are heterogeneous groups and or homogeneous groups. So that's kind of what it sounds like. So heterogeneous is like people might have different issues coming in, and I may have spelled this wrong, sorry. Homogeneous groups have maybe people with the same issues or a similar population. So an example of this is a homogeneous group might be all clients who are dealing with grief, okay? And let's get even more specific. Maybe they're clients who are dealing with grief between the ages of 25 and 35, and they're all women, okay? And a heterogeneous group might be clients who, um, like at a college, like counseling group, any client who's dealing with having trouble adjusting to college, right? So within that group, there's maybe men, women, maybe there's people who are struggling with anxiety or depression. We don't know exactly the nature of what their emotional distress is, okay? And then it is important to consider when you're setting up a group, we always want to be screening before starting the group. Okay, so remember that. You always want to screen, okay, your members before selecting them for the group. And the reason for that is some individuals are not appropriate for a group, okay? And that is people who might have antisocial personalities, okay, or are unable to or unwilling to self-disclose, people who are highly aggressive, or if they're actively in crisis or acute psychosis. Right? This is like common sense, right? If we're not going to put, right, we're not going to put Thanos, right, who's completely antisocial from, if you've watched Guardians of the Galaxy or Avengers, right? Somebody who wants to like destroy everybody else and cause chaos. We're not going to put him in group therapy because it's going to cause harm to others, and it's also probably not going to be beneficial for him. Or maybe the Grinch, right? Maybe the Grinch is not a good candidate, depending on how we look at it, for group therapy because he maybe is unwilling to share or self-disclose, and maybe he's highly aggressive towards others. Okay. Um, the types of groups. So there are task or work groups. So this is something you might see in a workplace. So you're accomplishing a specific goal or a complete task or working towards together to complete a task. You can see these people working together and giving each other a high five. And this generally involves a little less self-disclosure, a little less like talking about feelings, and a little bit more working towards a joint task. And then there is psychoeducational group. So that's when you as a counselor or maybe somebody who's working in the community will be teaching skills and providing information. So I led in my practicum, I led a psychoeducational group, which was teaching clients who had chronic mental illness how to manage, like specifically with like schizophrenia, like for example, over the summer when it gets hot, things to consider with medications and overheating. So teaching skills and providing information. Okay, it could be like a self-care group, any of that good stuff. Still, you're educating, the words that go educational, you're educating people about psychology. Really, that's what it is. Okay. And then counseling groups are a lot of where we might operate as counselors. So it's focused on personal growth and development and, emotional issues. And the distinguishing factor between this and a psychotherapy group, okay, it's very similar. Both of these would probably fall under the category of like what we generally think of as group therapy. But with psychotherapy group, these are people who might be diagnosed with an actual disorder. Okay. It's a little bit higher level of treatment. So with counseling groups, perhaps like this could include career counseling groups, this could include social skills groups, and then psychotherapy groups, you're going to be treating maybe this will be like a DBT group or a group that you're running in a hospital or an IOP or a PHP. Okay. And then mixed groups are having any combination of the previously mentioned groups, and they're with some examples of mixed groups could be support groups and self-help groups. So support groups would be like a community of neighbors getting together to talk about, you know, like, okay, wait, let me actually scratch that example. A support group for grief is an example, okay? And it might encompass psychoeducation, a little bit of counseling, okay? And then self-help groups will be a little bit different because in self-help groups, there may not be a professional present. So there might not be a counselor, and people may just be sharing information and trying to approach their issue that way. A good example of this is actually AA. Okay. And then T groups are also used in like businesses and organizations. They're training groups, and you're typically learning something like a skill or learning some information. Okay. So there's different ways of conceptualizing groups. One way is primary, secondary, and tertiary. Okay. And primary, you can remember this because it starts with a P and prevention starts with a P. Okay. Primary groups are more oriented towards prevention. So as we go from primary to secondary and then tertiary, it's going to, the level of need is going to increase. Okay. So for primary, they're really trying to get ahead of the issue. So even a stress, like coping skills group, okay? And it's talking about a healthy lifestyle, coping strategies, which reduce occurrence of difficulty. So, for example, the group that I ran in practicum, where we're talking about self-care and management for a chronic mental illness. Okay, we're teaching skills to get ahead of the issue, right? To prevent maybe hospitalization or um, unwanted symptoms. Okay. And then secondary groups are where there is a problem, but it's not so severe. So in this little picture I have here, there's a girl who maybe is feeling shy, or maybe she's not being included with the friends. Okay. So maybe she'll attend um, a shyness, like a social maybe a social anxiety, but not that severe, a group for that, okay? Shyness support group, okay? And then a tertiary group is with serious and long-standing difficulties. So that's kind of what we talked about before, kind of similar to our psychotherapy groups, okay? So the people in this might have a diagnosis. Okay. And then this gentleman, George M. Gazda, gave us a way of conceptualizing groups as well. So in this one, again, it kind of be a lot of these ways of conceptualizing it are kind of similar. So this one is split up, and I want to say he thought of this more with students in mind, but someone double check me on that. So the kind of lowest level, number one, is guidance groups. So that is almost preventative in nature. Maybe you're doing a group about anti-bullying, okay? And then as you go up, it's increasing in severity. So then counseling group is right there in the middle, just like that first model that I showed you. And then psychotherapy groups are with more serious and long-standing issues. Okay. All right. So group dynamics are generally any forces within a group, and that's pretty self-explanatory. Okay. All the things moving around in the group. Okay. And then group content is what's actually said. Okay. What are they talking about? Are they talking about, what they had for lunch? Are they talking about how their mom pushed them when they were 10 years old? Are they talking about whatever, right? That is group content, like the content of a book. Okay. And group process is the way that they are sharing this content and the way they're interacting with each other, right? So Sally, sorry, is, you know, Tina talking all the time and cutting off Callie? I don't know, just coming up with these names, okay? So is Tina always cutting off Callie, right? Is Callie not able to talk in the group? That would be a process, right? So when we're running a group, we want to consider both the content, what's actually being said, and also the process. Because someone can even be saying, oh, you know, everyone is mean to me and I have such a hard time making friends. But meanwhile, right, is so if Tina's saying that it's her content, but meanwhile, she's always cutting off Callie. So the process is revealing something about Tina's problem, something about her interactions. Okay, so Irvin Yalom is one of the most famous group theorists, and he has this model for group stages, which are orientation, conflict, cohesion, and termination. So the first stage of the group therapy in his mind would be just getting oriented, and then conflict, people start to kind of butt heads. Then they work through it, and now they're in the cohesion working phase, and then they move to termination, which is ending the group. He really focused on the here and now. Okay, so if you remember, his orientation is very existentialist, and he integrated a lot of existentialist ideas. And so with here and now, he was focused on like what is happening in this room, right? How does it feel when, you know, Tina is always cutting you off, Callie, right? How do you feel in this moment? So bringing it to the moment. And his most famous concept is these therapeutic factors of group therapy. Okay, so he, you know, there's 11 factors that he came up with. The first one is installation of hope. So by sharing and being part of the group, you may notice that somebody else overcame some issue, right? So I saw somebody else overcome their issue with addiction. So now I have hope that I'll be able to overcome my addiction, right? And then universality is the feeling that you have you're not alone, and other people, you're connected to other people who are also having the same issue, right? So in the grief group, like realizing, oh, we all experience grief, right? And then the sharing of information, so learning from each other. This is what, oh, drinking chamomile tea at night helps you. Maybe I'll try that. So you're learning skills from each other in the group. And then altruism is kind of similar to sharing of information. So by helping somebody else in some way, you may in turn feel better about yourself. And there's a healing part of that, doing something for somebody else. And the word altruism means like um for like almost like selfless, like doing something good for somebody else selflessly. Okay. Um, and then there is cohesiveness. So that is kind of like the feeling of working well with other people and getting along with other people. And then recapitulation of the primary family is a very interesting one. So the way he viewed group is that by being part of the group, your interactions with your group members are going to reflect how you are with other um, people outside of group, which is largely based on how the role that you played in your primary family, right? So if I was always a people pleaser in my family, odds are when I join a group, I'm probably going to be people pleasing and maybe be anxious, right? And so by being part of that group, maybe being called out on the people pleasing, then I'm going to learn to step out of that role and take on new roles and try different things, kind of recalibrating, right? My experience and, experiencing it differently than how I did in my primary family. And then social skills development is what it sounds like. You're learning how to be social in an adaptive way. Imitative behavior is kind of like copying what somebody else is doing and learning from them. Okay, so that could be learning from the group leader who's modeling healthy communication and boundaries and managing conflict, and you may imitate and learn from them. Interpersonal learning, again, this is learning from each other, like both information and also how to interact in a healthier way. And catharsis is the release of emotions that are pent up that gives people a sense of relief. And existential factors is being able to start to think about what is my purpose, what is the meaning to my life, and really kind of zoom out and look at your life in a deeper and more existential way. Okay, so that's Yalom. Now, Bruce Tuckman came up with, so I know Yalom came up with his own, theory of stages of group development, but really this is the most important one that you're going to want to know because this is the most widely used. So this model has 5 stages, okay? The first one is forming. So that is when you're initially meeting the group, right? It's most important to start to build trust in this phase, get to know each other, right? And then people are usually pretty nice and friendly in this stage, okay? Then storming. So these two, storming and norming, could also kind of be grouped into transition, like I've seen that in my textbook. But really, they are kind of 2 separate phases. So storming is when the group members, now they start to get to know each other and they start butting heads a little bit. Okay. And they might start arguing, or they might be quietly storming, which is like in their head, they're like, okay, I don't really want to speak. I don't want to participate because I don't really trust you. Or you seem like you're full of crap, right? Whatever it is. And then if they successfully work through that storming phase, then they go to the norming phase where they're establishing group rules and norms. How does this group function together. They're helping each other out. And then performing, they're really in that. They're like, they're going now. They're working through their emotional issues and whatever it is brought them to therapy. And they are, you know, accessing some of those therapeutic factors of group. Okay. And then the adjourning phase is really they're getting ready to leave the group and reflecting on what they learned and how it was for them and how it is for them to leave. Because some people could find, leaving and adjourning very triggering. Okay. So the characteristics, skills, and functions of a group, there are a lot. I'm sorry, group leaders. So there's a lot, and I just want to focus on a few. Feel free to pause here and look over these, but these are all just skills that the group leader should be having and using. So the ones I'm focusing on are linking, so connecting members who have similar experiences. Oh, I noticed, Tina, you mentioned that you were really struggling in high school, and that kind of led you to smoking cigarettes. And and Callie also mentioned her struggle with the pressures of high school and how that kind of led her to kind of like binge eating, right? Okay, whatever the example is, you both had high pressure environments, which led you to these coping skills, right? What do you think of that? So linking those similar experiences to point out the commonalities that maybe members are either noticing and not saying, or maybe they're not noticing. And then blocking is stopping harmful or unhelpful behavior. So that's the stop sign there. So somebody maybe is being aggressive or putting somebody down, or maybe being distracting and silly, right? Maybe the group leader would say, all right, we're going to pause here and refocus on blah, blah, blah. Okay, so that's stopping the unhelpful behavior. And then reality testing is checking if ideas are realistic, right? So I know you say that you want to lose like 10 pounds this week, but you know, what could be, a smaller goal that we could set in case that feels too big, right? Just checking if the ideas and plans are realistic. All right. So yeah, those are really the main ones that I've seen questions for. And um, but there could be questions on any of these. So the Johari window is another like key concept, and really it's in this square format. And what it's about is that what is what you're aware of um, has its limitations. So there may be other things about yourself that you're not noticing that others notice, and that can be a powerful factor of group to kind of bring that to your attention. So there's 4 quadrants. So there's, the open area. This is what you know and what others see and acknowledge. Okay. So I am brown, I'm Indian woman, and others can see that and acknowledge it, right? And the hidden area, maybe it's known to me, but unknown to others around me. So I know, that when I was 12, this X, Y, and Z happened, right? But others, by looking at me, may not know that that happened. And then the blind area is unknown to me, but others can be aware of it. So yeah, you guys would have to tell me what that is, right? I mean, an example of that is I didn't know, oh, this is a good example. I didn't know that I would kind of like hunch over when I would stand. I would never know that. Okay. I used to always kind of like tilt over at the hips. And I never knew that I would stand like that. And my friends kind of gently pointed that out to me, and that is something that I realized I needed to correct my posture by others kind of pointing it out to me. So it was unknown to me, but clearly other people saw it. And then the unknown area is unknown to me and then also unknown to others. Okay, so that's like what we really don't know. So we'd have to do some real deep group work to kind of figure that out, right? What is unknown to me and unknown to others as well. And then ethical and legal considerations that are unique to group work. The main one is confidentiality. So when you run a group, you want to let everybody know that as a group leader, I will be respecting confidentiality. I'm not going to share anything to anybody else that you guys tell me, with the exception of blah, 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 the usual exceptions. But as the leader, I can't guarantee that any of you won't go out and tell somebody else about things. So we're gonna, as a group, right, talk about how we can best maintain confidentiality and commit to that. But as a group leader, you can't guarantee that other people, like what other people are gonna do, right? So also encouraging the group still to try and not break confidentiality. And, you know, by doing that, that's how you gain the trust of your group members. Okay, so Jacob Moreno, as we mentioned before, I think we can kind of breeze through this, but he was the father of psychodrama, and he used improv and drama as healing forces. This was called the theater of spontaneity. Okay, and he used this for groups and families. Okay, so there's three types of leaders. There's autocratic leaders. So they are very authoritarian. So here's that example of Thanos again, right? And I'm sure we can think of a few authoritarian leaders. So they are like, this is the law and this is what you guys are going to do, right? They are very, their word is what the law is, okay? We kind of don't want to be like that, right? And then democratic leaders incorporate member ideas and feedback. And then laissez-faire leaders are like this lazy cat here. Not saying they're lazy necessarily, but they're laid back. They're letting the members do what they want and kind of run the ship. Okay. And the next idea here is the types of group members. So there's encouragers, harmonizer, the gatekeeper, the task leader. There's all these different ones. Let me actually come back. Let me do this really quickly. So encouragers are often offering praise. They're agreeing with others. They make others feel included. There's like this cheerleader. They're cheering people on. The harmonizer is mediating conflicts and trying to kind of reduce tension and create peace. Okay, like this guy here trying to make these two people make up. Okay. The gatekeeper is ensuring everyone has a chance to speak. So they're kind of like trying to, I guess, help out the group leader here and, kind of facilitating balanced participation. They're kind of calling people out for maybe, you know, cutting somebody else off, or maybe they're encouraging someone like, hey, blah, blah, I saw that you wanted to talk. What were you going to say? Okay, and then the task leader is also kind of like, I guess, helping out the group leader, or maybe they low-key want to be a group leader. They are helping the group stay focused on its goals and managing the discussion. Okay. The dramatizer is, have you ever had a friend who's just like a really great storyteller? They share their personal stories in such a vivid way that, it helps the other people visualize it. That's the dramatizer or storyteller. And the monopolizer takes up a lot of time in speaking. So somebody who doesn't let anybody else talk. That was Tina from the earlier example, right? She's just talking and then nobody else gets to talk. Okay. And to keep in mind, they may not be doing that on purpose, right? The help seeker is somebody who's frequently expressing confusion or helplessness, and they need sympathy and attention, right? So they might be talking a lot, about what's going wrong for them, okay, and trying to get some help and attention. And that, right? Again, they may not be doing this on purpose or even aware of it. And the aggressor is pretty simple, right? So that's like this guy. He is putting others down or attacking members personally often, and it's often rooted in insecurity. Okay, and then these two concepts I've seen in a lot of questions. So risky shift phenomenon is when you're in a group, you're more likely to make riskier or less conservative decisions, right? So that's like when you go out with your friends, right? You're probably going to be a little more brave and more likely to make risky decisions, less conservative decisions. Like this little kid ziplining and hanging off the thing with their friends, okay? So you're shifting towards a more risky decision as a result of being in a group. And then group polarization is as a result of being in a group, whatever your personal view is might become more personalized. So if you come into the group thinking, oh my gosh, I, you know, really hate working out, whatever, okay? It's a silly example, but I really hate working out, okay? And then you come to this group and then you're talking to all these people and now you're feeling even less likely to work out, okay? And maybe other people in the group have the opposite going on, okay? Or, you can think of it also like as, have you ever seen on YouTube those debates of like um vegan versus like carnivore diet, right? So they come into this group. Obviously, it's a debate format, but just think of this example. And, they all leave seeming more convinced of their own perspectives, okay? So your personal view becomes more extreme, okay? All right, and that is it for this presentation. I hope it helped, and best of luck on your NCE.